Good morning and welcome to our virtual conference today. I want to say thank you very much for being here with us today, all of you who are here. It's somewhat strange. I mean, all of us are in the place where we are all doing either teaching or workshops or something on Zoom all of the time, but it's still a little strange in this context to be doing it. This is where I can't see any of you, at least when I'm teaching my undergrads and I can see them. We're all in the Zoom session together. But thank you for being here with us. My name is Michelle Keels. I am the founder and director of the Trauma Responsive Educational Practices Project, who with a bunch of my staff, students, undergrad and grad students, and a lot of wonderful colleagues that you will meet throughout the day in the various sessions, have been able to do this conference today to be as supportive as possible for all of you so that you can be supportive for all of your students. And so I want to actually note a quick thing at the start, which is just that how today is June 5th, which is my my big brother's birthday. I forgot until my mom sent me a message this morning. But one of the reasons why that's important is that he is a really awesome educator. He's mostly junior high and high school right now. He's a high school teacher. But when he's in, I grew up in Canada. He's still there, Alberta, Edmonton, Alberta, and I know some folks from Calgary, at least, and I think some other folks from Edmonton and Alberta registered for this. So shout out to all of those in the place where I grew up. But when schools first went to remote learning, one of the initial things in the first weeks that was a policy was that they were asking teachers to not focus on COVID in their lessons and to really try to keep the content going. And we had talked about that. And one of the things that he said, he noted that, that's the official policy, but that he would be inserting lessons on COVID and what was happening and all of these issues into his lessons, using content-based ways. He teaches technology, science and technology, using issues associated with the content to talk about COVID, because he recognized quite rightly that implicitly what the policy was asking was to act as if what's happening in the classroom and in the learning environment can be separated from what's happening in kids' lives. The reality was they were all in remote learning because of this really, really scary and devastating virus, but they were to continue teaching as if everything was still okay. That was the initial policy. Of course, everything has changed, and schools everywhere recognize the need to focus even more on social and emotional learning to make sure that kids are in an emotional and well-being and cognitive state that enables them to focus on learning. And so part of the reason and inspiration for doing this conference was for having those conversations with my brother, who's an awesome educator, and really thinking about making sure that as we think about how to support our students through these issues in these times, that we are doing it based on being responsive rather than being reactive. And in this case, being responsive means a measured consideration and understanding of what we know works for kids when we think about learning, rather than our adult emotional reaction in that moment. And so that's why we're really focused on what is the evidence, what do we know from previous practices, and carrying that forward as we plan for students. I also have a timer to make sure that I don't go over, because there's so much that could be said on this topic. And let me see if There we go. I can get my slides to advance. Couple of quick notes is that you can discuss with your fellow participants on Twitter if you follow us at TREP Project, and also use the TREPCon20 hashtag in your tweets so that the conversation thread can get started and can keep going. And we wanted to make sure that we find some ways for us to engage and interact with each other. The panelists will be on these Twitter threads and conversation. The project staff will be on this, so that even though we can't interact in person and we can't all be in one Zoom talking with each other, we can still interact through these digital tools. And it's not, there we go. Another note is that we were doing a lunchtime Twitter town hall because want to honor two things. One, that the things that we're talking about today matter for the issues that are happening right now in American society with Black youth in particular, well, Black individuals and Black youth in particular, as they are fighting once again to change how this society engages with them and structures their experiences. So all of the things that we're talking about today matter for that, but also to make sure that for us, we don't try to separate our professional lives from these really pressing political and personal issues that matter for the youth that we're trying to serve. And so we're going to have a lunchtime town hall that was wonderfully, Alicia agreed to facilitate at the last minute, and all I had to do was send her an email to say, are you willing to do this? And she said yes, and put together discussion questions, and will really help us think through some of these things. For everything today, again, I wanted to find people who think deeply about these issues. So this issue matters a lot to me. Youth activism and just empowerment, but there are other people who do this work much better than I do. And so I want to make sure that for all of those things throughout the day, that other people are lifted up and other people are guiding our conversations when that's the best person to do it. And Alicia is one of those people. So we will get to meet her on the Twitter town hall and hear her thoughts about many of these things then. So again, for the Twitter town hall, just use the hashtag TREP town hall, but we will post things on Twitter to help guide the conversation. Many thank yous in order to be able to do this. This all came together really within a month with most of the panelists, and within a couple of weeks with social sciences computing. Dr. Joe Bonney, Sarah Outland, and EOS Trinidad are the primary hosts for all of the sessions happening today. So they are making this run technically, and all of them also have some other shadow staff from social sciences computing, making sure that if something happens with one of their computers, there's a backup computer that's there to make sure that everything will keep working. Joanna from the Scholar Strategy Network, really making sure that this is connected to policy and practice information that you need. And so she has been leading the organization of the briefs, guidance briefs that each of the panelists are preparing. And about a week after the conference, they will be ready, uploaded to the site. If you registered, you will get an email with a link to the brief, the comprehensive brief that can be downloaded with all of the strategies and notes that you'll hear about in the sessions today. Also, thank you to several amazing undergrad students here, Ali, Hillary, Nick, Kat, and Jocelyn. And if I have forgotten somebody, which I feel like I probably did, please forgive me, but none of this could have happened without a lot of support from a lot of people, making sure that everything is ready for today and beyond, when all of the sessions that are recorded will be uploaded, the briefs will be sent out, all of that stuff. So I have 5 minutes left, well, less than 5 minutes, in order to just, what do I want to do in less than 5 minutes? I guess the main thing, and the reason we're all here today, is just the realization that absolutely no teacher in any school, anywhere around the world, really can just teach the content in this upcoming year or really going forward. I think that's just, there's just been a reawakening of that we have to make sure that our students are in a cognitive and an emotional place in order to be able to benefit from learning, in order for that to happen. Initially, everywhere, really, it felt like to me, when schools were remote learning happened, there was this kind of like, let's just keep the content going. Let's do everything that we can to keep the pace going as much as possible. But then a gradual reorienting to the fact that, well, we also need to make sure that our students are in an emotional and mental place where they can benefit from this learning that we're trying to keep going. So what we're doing here today is a recognition of that and making sure that we have the strategies needed to make that happen. And along with that, really taking stock of just how widely disparate the effects of this pandemic has been in the US for Black individuals. And those are the numbers that we have right now. And what I want to share is just some sobering statistics that make clear that Black children in particular are in families that will have lost the most caregivers to this virus. They're going to experience the deepest levels of poverty and economic devastation from this. And they're going to have the longest and hardest climb out of that economic devastation. And so really thinking that one of the things that we learned from Hurricane Katrina in particular is that something like this, kids are not going to rebound quickly because their families aren't going to rebound quickly. The mental health challenges are going to actually rise over the next 2 years as things get, as the recovery is slow and prolonged, which means that us as educators need to be in this for the long haul and need to see their behaviors, not just in the coming months, but in the coming years. For many of them are still going to be reacting to their inability to manage the increased stress and stressors in their lives. And so what I want to show is just some of the most recent numbers for the Black COVID-19 death rates by state. And again, it's to make clear just how disparate the effects are. And so the bluish green, light bluish, I think aqua maybe, color is the percent Black in a state. And then the purple are the number of COVID-19 deaths that were Black residents in that state. And what you can see in terms of just the level of outpacing and disproportionate effect for the number of Black individuals who have died as a result of this. And those individuals, there are family members and there are children now that are going to have to try to figure out how to reorient their lives, how to live without the resources that caregiver brought to those families. And so this is going to be a long recovery period, and it's going to be a very unequal recovery. And so these are some of the states, and I'm going to show the other states also for which we have data, because I think these are when I saw these numbers, the statistics are just so sobering for what many kids are going to have to deal with in the coming years. And here's the last set of states. And so I'm really leaving us with this call to action, the need to make sure that when we see behaviors in kids, we are looking beyond the surface level behaviors to really thinking about what has happened in their lives that may be underlying why they're behaving in a particular way. And so I'm going to now stop sharing my screen in order to be able to turn it over to the first panel. And so I'll turn it over to Monique.
Thank you, Ms. Sherry, for that introduction. Thank you to all of you who are joining us today for this important and even more relevant topic of prioritizing and centering psychological and emotional trauma and planning for the upcoming school year. My name is Monique Riddell Smith. I am a Union Professional Issues Director for the Illinois Federation of Teachers, and that is one of the statewide teachers unions in Illinois. And I'll be moderating this discussion for the next hour or so. So when the plans for this conference were first being put together, there was a focus on, obviously, the pandemic, on COVID-19, and how that has completely turned our world upside down and has exposed, not created, but exposed and exacerbated inequities that have existed for so long due to institutional racism. But in the past 2 weeks, COVID has actually been overshadowed, if that was possible, right? And it's been overshadowed by yet another manifestation of institutional racism, and that is police violence on Black communities. So it becomes even more incumbent upon us to discuss the ways that this will also impact, on top of the pandemic, the psychological and emotional state of especially our Black students and educators. And so as we're thinking about and planning for next year, that has to be our focus, their psychological and emotional well-being. And especially as we hear about folks who are looking to reimagine what school looks like, we want to make sure that we are centering those conversations and school policy around the well-being of our most vulnerable and marginalized. So these are the folks who are often left from the table where decisions are being made, but they are the ones who are directly impacted by the decisions that are made at those tables and so-called reforms. So to help us to have this conversation, we have an illustrious panel of experts and of people who have been doing this work in other spaces for a long time. And they're really going to help us to talk through how trauma will manifest itself in this space, and also talking about what we have to do in order to support our students and our educators in our communities. So we have first Dr. Jordana Ash, who is a licensed clinical social worker, an mental health clinical mentor, and also faculty instructor with the University of Colorado, Denver, at the Irving Harris Program in Child Development and Infant Mental Health. We also have Dr. Cassandra Davis, who's a research assistant professor in education from the University of North Carolina, Chapel Hill, who studies education policy and the impact of natural disasters on schools and communities, as well as the social and historical context of education. Next, we have also Dr. Tanitha Grosslin, who is an assistant professor of educational leadership and policy studies in the College of Education at the University of South Florida. And last but not least, Dr. Stacy Overstreet, who is a professor in the Department of Psychology at Tulane University and a founding member of the New Orleans Trauma Informed Schools Learning Collaborative. So welcome to our panel. And we're just going to get started by having you all come and introduce yourselves once again, and then also take a couple of minutes to talk about what is this trauma going to look like, how is it going to impact our students, and what do we need to do in order to support them. So let's just go in alphabetical order, and we'll start with you, Jordana Ash.
Unmuting myself. Thank you very much. I am so delighted, grateful, and humbled to be here with this esteemed group of other panelists, as well as the entire day. It just is going to be a rich day of learning, and I think reflection, introspection, and community. So I am delighted, as I said. I'll introduce myself. I do have a couple slides. I don't know if somebody wants to put them up. If not, that's fine. I can just speak in general. As Monique introduced me, I am currently the director, thank you, of strategic partnerships at the Hemera Foundation, which is a small family foundation in Boulder, Colorado, where I'm located. And we have long focused on early child development and lifting up, excuse me, those programs and partnerships that really work on parent-child relationships. I was brought on not only to lead that work, but also to lead our new work in adolescent mental health. So I joined the foundation last July, and the timing couldn't be better to really think deeply about the needs of our young people, our adolescents, our young adults. But my heart is really in the early childhood world. Prior to this role, I spent 5 years as the director of early childhood mental health for the state of Colorado. And I believe that Colorado is one of the few states that actually had a position of leadership and authority to really address the needs of very young children and their families and those who care and love them. And so this work, my present work, is really an extension of that deep experience and learning and working alongside many, many collaborators to elevate policy and practice around early childhood mental health issues. And that's the perspective that I'm going to bring today. Many of my colleagues will also focus more on needs of older children, and I am excited to hear about their thinking. I'm glad that I was able to kick off this panel because we really want to ground all of this thinking about where our children come from, right? And we know that health and development and disparity begins even before our young children are born. So my reflections today are really on mental health policy and practice as it relates to our very youngest learners, even before they come and arrive at our doors. And we understand the science of development and trauma, and we can take a life course perspective so that every child is poised for achievement and learning and good health outcomes. But in order to do that, we really need to have bold and declarative action that infuses that knowledge into the systems, including our education systems, that we all touch throughout our day and our work. So a young child's growth and development, of course, is affected not only by the family that they're born into and their extended family, but their access to healthcare, their access to safe communities, healthy food, outdoor spaces. And in my view, all of those things, all of the policies that affect those things are actually mental health policy, because it all has to do with how well our children are able to thrive, grow, and flourish, or conversely, the negative effects on their growth and development. So when we turn our attention, pardon me, to trauma, we need to keep in mind the multitude of adversity that some of our children, that many of the children that we're describing today are facing. And we want to remember that their brains and bodies hold those experiences. So as we were reminded in the opening remarks, you know, the behavior that we see is really a manifestation of what young children are bringing to us and what we see when they arrive at our doors, but it is not the end all, right? The behavior is just a call for help and the way in which that young child has of saying, I need something and I need some support. We can go to the next slide. So some of those traumas we can see and some we cannot. We can know some things about children, but we often don't know the burden that they are carrying. So this pandemic, of course, has affected all of us. And the recent police brutality, police violence, of course, has affected all of us. But to a different degree, right? It differentially affects young children and families, children of all ages actually, and their families based on what their burden has been. If someone could advance my slides, that would be great. The cumulative science tells us, and we know this deeply, that the accumulative burden of adverse experiences matters. And when we look at the different spheres that these traumas and adversity have been built into systems, historical, institutional racism and disproportionality, generational trauma, community trauma, and think about those children that are born into these experiences. The burden is great, but what we also want to think about is what are the resources? What are the cultural and familial strengths? So when we're thinking about burden and the reality of the burden that is affecting our families, we need to be thinking about how do we tap into the resilience of each family and how do we shore that up at a time when their burden is extraordinary. Monsieur mentioned that the many Black children have lost family members to the COVID and to police brutality, frankly, and that those adults are the adults in children's lives that make a difference. When you're experiencing child traumatic stress, what it means is that adversity in the absence of a caring adult. And so when we think about that calculation and that dynamic, we really need to be thinking about the decimation of adult resources at this time, both external resources like job security, economic security, community connections, and internal resources like self-care and the effects of grief. So the adults in children's lives right now have been also unduly affected by the pandemic and by the recent events, recent police brutality events. We want to remember that our educators, those of you who are on this call, are also members of the community, and we can't forget that, and we can't forget the stress that you are under as well. So very briefly, even pre-COVID, mental health supports that's preventative in nature in schools was a broken system. It was not equally distributed. Care and support was not available widely. School social workers had undue burden of the amount of children that they were expected to serve, so that they couldn't really help educators' wellness as well as build social emotional skills. Very uncoordinated across systems, some housed in educational systems, some in behavioral health system, and generally underfunded across the system. So just in conclusion, I want to leave you as the rest of the panel gets started with a couple of comments on how to guide into the future. So if we can advance the slide, what we really mean here is that there is hope and there are some things that we know, so that there really are best practices for early mental health services. And I can speak more about that during our moderated discussion, but the information is out there, the evidence base is out there, and these interventions work. I also will say that I was, very grateful to see conversations about individual mental health, young people's mental health, family mental health, and even our very youngest learners' mental health has been promoted widely during the pandemic. And there are resources out there for you as educators on how to keep these conversations going. And that's really our charge, how to build on what has now maybe opened up a little bit with a little reduction in stigma around mental health, because we are all experiencing stress and confusion and anxiety around what comes next. So keep those conversations going, utilize those resources about emotional health and emotional literacy in your classrooms. And then finally, we all are understanding that these are going to be long-term effects of trauma, but we also can tip the scales in all of our policy decisions at the school level, at the district level, so that we are, as I said, tipping the scale towards resiliency and counteracting the effects of trauma. And what underpins all of that is your relationship with those children and families. And so I'm going to leave it there for Monique to transition us to the next panelist, but I am looking forward to the next 45 minutes or so to deepen this discussion. Thank you.
Thank you so much for that. So we'll move right on to Dr. Davis.
Hello, and thank you so much for inviting me to this great panel of discussion. This is definitely a conversation that is needed, especially in times like these. So I would like to just kind of quickly talk about the research that I'm involved in. As it said earlier, my name is Cassandra Davis. I'm a research assistant professor in the Department of Public Policy at UNC Chapel Hill. So I guess next slide, please. And I'm going to talk about my research. So I am interested in the environmental disruptions to schooling. And particularly, I focused on the impact of hurricanes. We've had a busy hurricane season with kind of looking back to Matthew that hit in 2016, that hit the Carolinas. Also thinking about Hurricane Harvey that hit Texas, the Texas region in 2017, as well as Hurricane Florence that hit our East Coast and other areas in 2018. I'm really interested in understanding how schools are able to recover after storms, particularly the social schools that are located in social vulnerable populations. And, kind of gathering and meeting with educators across the states and the regions, trying to assess what information is actually out there. And there's really little to no information, little to no research. So the research that I have been able to gather, even before doing my research topic, they really focused on the social emotional impact of storms. We see that children, they experience much higher rates of post-traumatic stress than adults do after a storm. And we all see that children are eventually able to return to normal within months or even years later. So with the study that I was looking at, next slide, please. I'm going to just share some brief findings, and I really look forward to the conversation with my colleagues coming up. But some general findings that we had, we found that that the educators, both educators and students, there was a social emotional impact. Most of the time we see literature that focuses just on students, but it's not surprising that we also see this amongst our educators. As a former classroom teacher, I can absolutely attest to the fact of you're dying to yourself and you're putting the needs of your students first. This absolutely happened after a disaster, and I would expect it to happen after an event such as COVID, and even during COVID. Educators talked about how they had weather-related anxiety, and that could be an example of a rainstorm happening in April, months after hurricane season, but still educators and students were terrified that a hurricane would come. Some of our kind of general findings, again, where we surveyed educators and we asked them to identify the type of moderate to extreme impact of the storm on themselves, their colleagues, and their students. And what we found is that they said that students, more than half of the students were, extremely impacted by the storm from a mental perspective. About half of their colleagues and about a little bit more than a quarter of themselves agreed to this. Additionally, with that, respondents talked about a continuation of stress. This is important, that it wasn't just when the water went away and the school was back and everything and the electricity was on, but that there was a amount of stressors immediately after the storm, and then even months to years. Just recently administered a follow-up survey to residents who were impacted by Hurricane Matthew. Again, that was 2016. And educators were talking about how they are still recovering. They're still mentally, emotionally recovering from the storm that happened 3-4 years ago. Also, the mental health, there's a ripple effect that if an individual as a student is not doing well, that absolutely impacts their academics, it impacts their behavior, and it also impacts their attendance to school. One question that we asked educators, and finally, the question was, what's missing? What could help you recover faster after a disaster? And overwhelmingly, individuals said mental health providers and support. So what are the lessons that we can learn from schools and schooling and educators and students being impacted and affected by natural disasters? And how can we apply that to COVID? Just some quick things, just providing counseling services, recognizing that that period of recovery is not once everything is over. It's crazy because 2 days ago feels like months ago, right? And so in that day when COVID-19 is in our past, we as educators have to understand that there will be long-term rippling impacts, especially on our most vulnerable populations. Also, another point that I just want to leave you with, being responsible to the needs of educators and students. Again, as I said earlier, we are we put our foot in our direction into supporting students, but oftentimes we leave ourselves behind. So what does that mean as an educator? What does that mean as an administrator who is leading teams of educators? What does that mean for ourselves? We'll have to have this conversation on the higher education perspective, but also having this conversation in the different areas, ensuring that we are taking care of our mental health well-beings so that we can then facilitate and support other students. So again, I'm excited about this conversation, and I look forward to engaging in a conversation, especially that is around meeting the needs of students and educators. Thank you.
Thank you. Dr. Grossland, we'll move to you. Dr. Grossland, sorry.
That's okay. Good morning. My name is Tanitha Groslett, and I am an assistant professor at the University of South Florida in Tampa. And one of the things that rings over and over to me, as we've discussed here this morning already, is how can we notice and even embrace students' emotions without noticing our own emotions too? So that has been the focus of my work in educational leadership and policy studies, is the focus on educators' emotions. And I have a commitment to this work because I started my career in urban education and kind of urban centers, urban areas in the United States. I used to work at the Human Rights Center at the University of Minnesota. And from there, I became a teacher, an elementary grades teacher in the Chicago metro area and in the Twin Cities, Minnesota, in Minnesota. And during this time, what I have noticed here is that when I talk to families and I talk to students and I talk to community members, is that they have a concern about issues of emotional health, inequity, and disproportionality. And I addressed their concerns, and we talked about this. And this work led me into being an equity coach for my district because of my passion around what educators and kids feel are important to them. So I even see this beyond my work as a coach when I used to work for the school districts, and now a professor. I work with educators around issues of conflict in our communities. For example, I've talked with educators about their experiences after the Baltimore uprising, and I've written about this before. And I've talked to Minneapolis public school teachers about the pain around police brutality, especially after the killing of Philando Castile, who was an educator for St. Paul Public Schools. And the stress of uprising, and now compounded with issues of the pandemic and the inequities around those, these are serious things. So if you would advance the next slide, please, because I want to talk about how we can address some of these emotions in our work and care for not only our students' emotions, but how our emotions are impacting what we talk about and what we do not talk about in our classrooms. I had teachers tell me all the time that they try to talk about issues in their classroom, but they would literally cry and cannot talk about issues of stress, and they cannot talk about issues of the pandemic or police brutality, especially after Philando Castile was killed, because he worked in the public schools too. So here are some just strategies that I have seen work in schools. So I have a few listed here around emotional awareness and really thinking about how can we build robust policy teams from multiple perspectives? How can we involve students and family members in new ways, not the old-fashioned kind of ways that we've been doing? How can we get creative around this? Not just have them show up to meetings, but really have them involved. I think about how I have a lot of teachers who have written grants around addressing well-being and inequities of well-being in schools concerning even teachers from racially disproportionate communities who work in schools, and the stress of working in schools as a racially underrepresented teacher. I have talked about labor contract negotiations for workplace stress, especially for teachers of color. And these are such personal issues. And I noticed later in the conference, one of the sessions is on coaching. And as a coach, it's important to have coaching during working hours so that teachers don't have to do professional development on their own time and outside of their workday, but actually build it into the workday. And that goes back to the labor contracts related to workplace stress. And in conjunction with these other things I've seen in schools where educators are able to foster their own emotional health and empower themselves emotionally is around what is called self-study or inquiry or action research, depending on which venue you're working in, what your context in is. And they use this strategy to bring these issues to practice and bring them to bear actually on their everyday practices and what's happening in their schools. What inquiry is a form of professional development that's rooted in the experiences of educators. And when we focus this on issues of emotions, it can be really powerful. So for example, these can look like inquiring about how your emotions are impacting what you do or do not in schools. And it's really, the beautiful thing about inquiry or self-study is that it's differentiated based on the teacher. And it is also systemic and it comes from within. And sometimes it can happen in collaboration with outside researchers and sometimes not. What inquiry has done for schools is build up communities of practice. It's supported individual teacher growth. It also deprivatizes teaching in special ways. It promotes collaboration in schools, and it fosters teachers' knowledge construction in a time where teaching has become overstandardized, and this overstandardization has stifled creativity among a lot of teachers. And that's one of the things that one of the teachers I spoke to about the Philando Castile killing was that she wanted to talk about what happened because it was right up the street from her school. And the kids would say things like, they're killing us. But when she wanted to make this a systemic approach, she wasn't able to. She had a lot of pushback in her school around talking about these issues with the kids. And these similar things are going to happen with COVID, especially around disproportionality and how it's disproportionately impacting Black and Brown communities. So taking the steps of action research, inquiry, or self-study is listed here. And I just wanted to say a word of caution because one of the biggest things I see in implementing action research is developing a wondering or a question of study. So going back to the coach, this is where a coach can be handy. They can not only help the educators, principals, I've seen superintendents do inquiry and things like that, develop good questions that will work, and also be a data collector too. So in conclusion, if we don't think about how our own emotions is facilitating our personal practice, our professional practices, and how educators are also traumatized due to systemic oppression, issues of like trauma-informed education, for example, is very limited. So thank you.
Thank you so much for those practical examples and practical steps. We really want to delve more into those. So last but not least, Dr. Overstreet.
Good morning, everyone. I really appreciate the opportunity to be here and talk with you all today about sort of how we've been thinking about this issue of prioritizing psychological and emotional trauma in planning for the next school year, and particularly as it relates to teachers. So if we could go to the next slide. Okay, great. So really, I want to inform the thinking that we've been doing here in New Orleans. We conducted a survey with 454 teachers. About 54% of the respondents were Black, about 80% were women. And we really wanted to understand their COVID-19 related impacts. How are they experiencing this pandemic? And also, what do they think they need coming back? So I'm going to talk to you today about kind of three important findings in this discussion of centering teacher wellness as we think about the next school year. The first is, not surprising, we've all been impacted by COVID-19 and the stay-at-home orders and the stressors that are associated with that. And teachers have a similar experience. So really, universally, all teachers report stressors or potentially traumatic experiences associated with COVID across the sample. The average number of stressors was actually 7 for teachers. So a lot of stressors related to our current environment. And I think the important point about this is that this is really a collective experience that the entire educational community is having, right? So we're going to have a workforce coming back to schools, either virtually or in person, with the weight of those stress and trauma experiences. And they're going to be walking into jobs that are already stressful. I mean, we know from teacher surveys and teacher reports that most teachers find their jobs stressful. So you have sort of the baseline stress of the work, and then that happening under the weight of these experiences. The second finding I want to tell you about is, you won't be surprised about, we've already sort of touched on this theme in the introductory remarks and in this panel, but that for Black teachers, COVID-19 hasn't just been a collective experience, but it's also been an experience that's tied up in systemic racism. And I think in our data, that's shown most clearly in the disparities that we see and the health impacts of COVID-19. So you can see here that Black teachers are 2.7 times more likely than white teachers to have had a family member or friend become ill with COVID, 4.3 times more likely to have become ill themselves, and 4.6 times more likely to have experienced the death of a family member or a friend due to COVID. In New Orleans, Michelle showed the rates earlier of the states and the disparities in health by states. In New Orleans, there's just disparities are even wider. So about 75% of the folks who have died from COVID-19 in our city have been from the Black community. So that is showing up here in our data. And I think, as Monique pointed out, right, that as members of the Black community, our teachers are also being exposed to another form of systemic racism right now, or at least the most recent examples of that systemic racism, which is violence against Black and brown folks by police and also white vigilantes. And so we've got, for our Black teachers coming back, unique experiences of stress and trauma right now that are really compounded by institutional racism. And so I think being clear about that and knowing that that's happening is really important. Okay, then the next slide will demonstrate kind of the third main finding I want to show you. So that might have gotten lost. Next slide, please. Thanks. And so the third finding is, when we asked teachers actually how confident they were that schools were going to be prepared to address the experiences of students and teachers related to stress and trauma when they reopened. And although, well, just let me tell you, there's a fair amount of skepticism. And so you can see on this slide the response to those questions from the total sample from Black teachers and from white teachers. And although Black teachers are slightly more optimistic about the ability of schools to handle this stress and trauma, about at least 50% of all teachers expressed some concerns that schools were going to be equipped to do this. In general, teachers expressed concerns that the weight of managing students' emotional and academic needs is going to fall on them. So Cassandra talked about this, right, in terms of the hurricane stuff. So, and it's true. I mean, there are not a lot of mental health resources. Teachers know this, and that they realize that they're going to be the ones who are going to be expected to step up and sort of manage these needs that their students have. And they're also really worried that they're not going to have the supports they need, not just around mental health for students, but they're also worried that there isn't going to be this space and time to acknowledge what everyone's gone through and to really process the trauma, focus on building relationships. There's a concern that there's going to be a push to move very quickly back into academics as opposed to allowing that time and space. Teachers are also worried that they don't have all the tools in their toolbox to step up and provide what their students need in the classroom. And so they're really interested in trainings that will help build their social emotional learning, their own individual skills, but also policies and procedures at the school level that will reinforce that work, as well as trauma-informed practices. Teachers are worried, and Cassandra has shown this in her data, not just about mental health supports being available for students, but for their own access to mental health supports. And so they really are feeling that they're going to need that both in terms of formal mental health supports, but also just being in a climate that is supportive of self-care for teachers, and really encouraging teachers to monitor their stress, provide like community opportunities for coping with the stress, that sort of thing. And then the last major concern I think has also been mentioned is that they're worried that they're not going to have a voice at the table. Teachers want to participate in the conversation that's happening around plannings for reopenings and likely future closures. And I think making sure that they're part of the conversation, and particularly voices that aren't usually included in this conversation, so the voices of Black teachers, are going to be really important. So in conclusion, I just want to highlight the fact that this is important. I'm really passionate about being a voice for teachers and creating supports, because we know that if our teachers aren't in a place to manage their own stress, that's really going to have a negative impact on the relationships they're able to form with our students. And if students don't have those strong relationships, then we're going to start to see even further impacts on their academics or behavior. So that's mostly all the rationale for why this is important. We also, from this survey, have a lot of policy recommendations that you guys will get, and I'm happy to answer some questions about that, but I'm going to stop there.
All right. Thank you so much to all of you. I have so many questions that I just don't even know where to begin. And I know we don't have a lot of time, so I'm trying to think about where best to go with these questions. And so I really appreciate being, a former 7th and 8th grade middle school teacher in Chicago public schools, and also now being a part of the teachers union. I'm both a member of the teachers union and also work for the teachers union. The emphasis on making sure that our teachers are well and our educators are well, because that is often a piece that is missing when we talk about policy. And so I really appreciated the fact that all of you have really emphasized that we have to make sure that our educators are well, and they're often not well because they are left out of the conversation, but they are the ones who deal directly with students and with families. And so I just want to talk for a few minutes again and center Black educators. We know Black educators serve a vital role in their community, and especially with Black children, having that cultural understanding. And that is going to be needed, especially in this time. But we also know that there is a dire shortage of Black teachers across the nation. And so my question is, what can be done practically for us to support the Black educators that we have in order to retain them during a time when they're going to be desperately needed, but also at a time when they are experiencing high levels of toxic stress?
Mm-hmm.
So you're throwing that for any of us to answer?
Yeah.
Okay, well, I'll jump right on in. As I said earlier, as a former classroom teacher, and knowing there aren't that many Black educators that we have in our nation, we also know that So part of it is part of my background is kind of looking at the historical context of situations. I feel like before we can really, yes, we need to talk about this in reference to the pandemic, but we also need to go back a little bit into the past and talk about some healing that needs to happen, especially after the Brown versus Board of Education decision. I mean, the issue of having African-American teachers wasn't as much as an issue back in the day, but with the decision and the integration of Black students, it did not call for the integration of Black educators. So we saw very intentional moments where schools with districts or policies that were not allowing Black educators to continue on and educate within districts. I find that especially being situated in a southern state, and I also find this in, my grandmother was an educator, my grandfather was an educator, that these kind of past hurts and past harms conversations need to be brought up as these are the things that happened in the past. We want to include your voice. I believe Dr. Overstreet was talking that the inclusion of having Black educator voice in the conversation. The need of saying that not only do we want your voice because we know that you're educating students, but we value your voice. We value the impact and the effect that you have on the communities that you are situated in, that you serve. But in order to even talk about progress and recovery, there needs to be some bit of a celebration of Black educators, their voices, their perspectives, to allow us to move forward and to really be able to address this answer about turnover.
And can I comment on that too, Monique?
Absolutely.
One of the things I have just recently wrote about was the contract negotiations, because of think about this. The Black and brown educators we do have working in our schools are racialized in the buildings themselves. They tend to work in schools where there are mostly Black and brown children. So what are the implications around that for contract negotiations? So we have to think about that. And then too, because I was one of few racialized teachers, Black and brown racialized teachers in the school I worked in not necessarily in the Chicago Metro, but in Minnesota. And I talked to a lot of other teachers who there is pain when you're the only one. Mm-hmm. So how can we take this up? How can we not just have, a lot of the work, a lot of scholarship talks about, just enough. So the racism of having just enough. Oh, we have one. Oh, we have two. But what does this mentally do to our psyche when we're the only one there? Or if there's a handful of us, Black and brown teachers, we have to serve on all of the committees. Mm-hmm. So that creates more stress and burnout. And we're talking about recruiting and retaining teachers from underrepresented populations. Look at what we do to them when we put them in schools. Let's take a look at that. Mm-hmm.
Yeah, I think if I can just add one other thing, I think important to both of the points that you all have made, I think the other thing that's important is that leadership take a stance of cultural humility and acknowledge the fact that they don't know automatically what's best for their teachers or what the teachers' experiences are. And also get comfortable with the fact that one size doesn't fit all. And so there may need to be different kinds of supports for teachers having different kinds of experiences. And I think just being, we hear from teachers all the time, like, oh, I can't do that with that student. Like I have to treat everyone exactly equally, right? So I think in schools, having a conversation of equity can really be particularly challenging, but I think it's definitely needed.
Right, and not up to our Black or brown educators to be the sole voice to say, we need to have those conversations, right? We need to have everyone responsible for making sure that all of our educators are emotionally well, so that they can then in turn take care of the children that we're asking them to provide not only the academic, experiences, preparation, and results, but really the whole child. And I was going to just say something very concrete in this in terms of recruitment and retention. And it's along the lines that Tanitha said in terms of contract negotiations is pay. What are what is the pay that teachers receive, and how is it that we use financial contract negotiations, compensation to advance, retain, and recruit educators that we know we need to.
Thank you. So piggybacking on that, we know that schools that serve low-income students, that serve students of color, are already under-resourced, right? And so they rely more on state funding. So given that states will now be suffering from this economic hit from the pandemic, how can school districts and states, administrators, how can they prioritize, plan for, and support students and educators' mental health? Since all of you have talked about the importance of emotional and mental well-being, and that's often left off the table anyway, but especially with the budget cuts that might be coming to schools, what can we do within our schools to really prioritize and to support our educators and our students and families in their mental health?
Well, I'll just jump in here, but I am interested in hearing what others have to say. And I think if we need to shift the narrative and the frame that social emotional learning is something separate from overall academic, achievement, and that in order to learn well, every child needs to be emotionally healthy, emotionally regulated, and have the social emotional skills to navigate their school day. These things are not in individual topic areas. They are absolutely intricately related and foster learning when we have emotional well-being. So I would like to center and start with and prioritize emotional well-being of students and educators as the first priority, as the first step in, and use that port of entry to then look to getting the academics back on track.
So another thing that I would like to add, so with the respondents and the participants that were involved in the study, and we looked at after these different various hurricanes, a good part of the schools that the individuals were situated in were low resource communities, communities of color. And so that they didn't necessarily have the luxury to have the millions and billions of dollars brought in to then rebuild their schools. And so they often talked about the strategies in which that they would use to help recover instead of kind of waiting for that check, right? Waiting. And some of the recommendations that they made, they talked about just using, it might sound really simple, but maintaining that communication, they talked about having PD, professional development checks, where you would have the PD time, but then you would do these kind of face-to-face, group-to-group check-ins to get a pulse check of seeing how people are doing. In addition to that, really having patience with recovery. And, that meant that, maybe my home or my apartment or my space is ready to go, and it really didn't impact me that much. But for my colleague and my peer next to me, her place was devastated. Or maybe it was the reverse. Just having that patience that each person is dealing with the situation in their own way, and having patience with individuals on their ability to recover. So this is not my voice. This is from the voices of the educators, of the thousands of educators that we've surveyed and the hundreds of educators that we've interviewed, that really talked about opening up, strengthening communication, and having patience with each other.
I also just think that some political advocacy is important. So budgets are going to be smaller and there's going to be pressure. But if we don't have our voices out there, that some of that must be carved out to support this, that it's just critical, that there aren't choices, then I think all of it will get allocated to other sorts of things, because folks don't understand, as Jordana is saying, about how SEL can be integrated into academic content, or they rely on kind of communities of care that happen in schools. Really important. But I think some political advocacy here is also going to be critical.
And just to echo that, I've seen how political advocacy can really make a difference in communities. And then also watching the dollars and watching where the money is going, because sometimes districts and states and the government and places like that will say that they don't have the money, but they have the money. It's just about saying, okay, well, we know you have the money, don't tell us you don't have it. So we want to advocate around getting the funding we need. And then taking a look at what districts are doing with their funding. So watching the dollars, when you watch the dollars, it will tell you where their beliefs are. What are they really believing in? Are they investing in marginalized communities, or are they investing somewhere else? Because the money is there. We just have to advocate for where it goes.
Thank you for that. I want to definitely piggyback on that. One of the things that I've stopped doing in some cases is stop talking about under-resourced, because in some places there are resources, but the resources are not going to where students and families, communities, educators want them to go. And so this has also come up recently. We know that communities have been doing, and youth have been doing this work on the ground for a long time of trying to remove police from schools. So let's kind of delve into that, because that is now definitely something that has been put front and center with the police brutality cases. And we see, I think, Portland and also Minneapolis school districts have both said that they're going to remove the police force from their schools. And so when we're talking about trauma, we're talking about emotional well-being, and especially for our most marginalized, our Black and Brown communities. Just want to get your thoughts about police in schools, the role they have or don't have. Just want to get your thoughts about that.
Well, I'll start a little bit on that. Is I have noticed the same thing, that schools have become more and more overly policed, and how police brutality is actually playing out against Black and Brown students, and how it's creating a lot of pain around that. And the overrepresentation of even Black girls being policed and marginalized by police in schools. And police are not, their profession, they have an important role. So I'm not into police bashing or anything like that, but their profession is not our same profession. They're not trained the same way educators are. So we have to be really careful about using police and resource officers in schools. So it's a lot of great work out there. I can't think of scholars in particular, but especially in Chicago, like at UIC and places like that, a lot of great professors have been doing work across schools and looking at the impact of policing in schools and how that can be not necessarily a good thing. So there is a lot of growth that needs to happen around that area.
Anyone else?
It's not my area of expertise, but I mean, I think the other important thing is if schools are going to have school resource officers or police, I think really way more intentionality about understanding what that means, how it typically operates, doing some trauma-informed training with those individuals so that they can take really a different approach than I think they're often brought in for. So I just think we have to be really careful about that. And the signals that it signals, not just to students, but when parents come to school and they see a police person at the front door, I mean, that can also be triggering for them as they're entering this building to be an advocate for their children. So it has implications, I think, all the way around.
I would say that it's worth reconsidering rebuilding the entire discipline system in schools. I think about the early childhood aspects of disproportionality for expulsions and suspensions, and see that as early parts of the continuum that have to do with when is it that we're setting up young boys in particular of color for suspensions and expulsions, even as young as 3 years old in our preschools. And that implicit bias that affects those disciplinary practices continues and has long-term negative consequences, as we all know, for our students. So I think discipline in general really needs to be relooked at, reworked in light of institutional racism and structural disproportionality.
And if I can just say one more thing, this is going to be I think this is going to continue to be a big issue in schools because everyone will be stressed out when we all eventually come back. So the kids will be stressed out, the teachers will be stressed out. And I've seen, and we probably all have seen that play out in schools where for example, when I was teaching in an elementary school, and I won't say which district it was, but I had a teacher call the police on one of my students. And he didn't even do anything. We're enough for it to be police involved. That's kind of dramatic. And like you said, Jordana, this play out in early settings. It plays out in early grade schools where educators are really stressed out and they take it out on the kids, unfortunately, and they call the police on elementary kids and things like that.
So yeah, I would absolutely agree with the different things my colleagues have said here, and thinking about tying it absolutely to kind of the emotional well-being of that student. If I'm a part of a community and I go back home and I see, police brutality is kind of a common kind of conversation, versus if I go back home and my father is a police officer and I have uncles who are police officer, my ability to work in school is going to be completely different. Either when I see an officer in that building, I could either see that officer as a friend, as an ally, or I could see that officer as someone who doesn't like me, or who has the intentions of harming me, regardless if it's true or not. So I absolutely agree that there really needs to be a rethinking, restructuring. What if that's the direction that we as a nation or schools are moving forward, the intentionality of those bodies within buildings, and hopefully not being used to continue already oppressive actions that are happening within society and pushing that in school, because that doesn't help any of our students. That doesn't help them with learning. That doesn't help them with advancing or anything. So I absolutely agree with my colleagues.
Yeah, so I think we have to think about Dr. Grosslin, right? And as well as when she initially spoke about this, talking about where the dollars are going, right? Are we putting more dollars towards the policing of our young people than we are in counselors and in social workers and in mental health supports? Because that in itself speaks volumes about what we think our students need.
Exactly.
So just shifting a little bit, but still kind of on that same on that same spectrum of what do schools need to do to restructure their academic goals? We know that schools are spaces where students come and get academic instruction. That's their fundamental purpose. But given all that is going on and all that is happening these last few months, how do schools restructure their academic goals? And specifically talking about things like high stakes standardized testing and also teacher evaluation. What do we need to do with those?
I'll talk a little bit on that because my background is in curriculum and instruction, also in addition to leadership and policy studies. But really empowering teachers, I think, is a great place to start. So empowering them, not just saying, oh, we're empowering our teachers, but like actually do things to empower teachers to have an impact on how they are able to facilitate the learning of their students. So, and I always go back to action research, inquiry, self-study, but how can we develop powerful questions and quality questions in schools? So if you're working, it could be like a school level, it could be at the building level, it could be at the district level. Like I said, I've seen districts take up and superintendents take up action research and self-study before. But developing powering questions and quality questions. And then from these questions, that directs our data collection, right? Because if we're asking not good questions, we're going to collect the kind of data we want to collect, or what outsiders may want us, not outsiders, that's probably not the best choice of words, but not necessarily what our students need. So really thinking about how to use inquiry in a way, but starting with developing questions about learning goals and reevaluating these learning goals from an inquiry stance. So because it's going to look different in a lot of different schools and districts and across the states. But thinking about it in that way is my first jumping off point, because that is a way to empower teachers to facilitate the learning of their students better.
So I have kind of two different perspectives. One is kind of blow up the system, right? I had yeah, I had a conversation with I was consulted by our government and asking about the ways in which that schools are recovering after hurricanes. And part of my advocacy, part of my perspective is we need to talk about testing. We need to pause. We need to reduce, eliminate. That might not have been the best response that they wanted to hear at that particular time. But it's interesting now with COVID, where testing has been put on pause. I had another recent conversation again at the federal level, and my recommendation was testing for next year. In thinking about how we're talking about, and I have educators that I know that are for me and educators that I know who are against me, but also thinking about this connection, this interconnectedness with the ability to educate, to teach, and stressors and mental health. A good piece of my respondents and a good piece of, as a former teacher, and a good piece of my connections with educators is this monster of testing overhead. And so really trying to think of, now we have COVID-19, we have the things that are happening in our streets, and now also coming back to a classroom when students have presumably been out for 6 months, to now think about the monster or the monkey on my back of testing. It's something that really needs to be rethought, and I would absolutely believe that it's added pressure that, particularly in this time, we probably could use a little bit of less pressure. So that's me. I'm trying to change up things. I had a great conversation with a Principal Hopkins and from Durham Public Schools, and he talked about the need of really kind of changing that. We're not just talking about equity anymore, but we're talking about justice. And it's such a fantastic, it's such a way of, we're not throwing around haphazardly saying the word diversity. We're not saying that now with equity, but we're really focused on what does justice look like within our school buildings. So that's probably more of a practical within the schools of addressing or kind of stopping and starting and thinking about how can we ensure that justice for our students, for our families, for our communities, for ourselves, what does that look like as we're continuing on? But also to my policy people, to my advocates, to my educators, I am really kind of hesitant about pushing forward with testing next year.
Hear, hear. I don't have anything to add to that. Fabulous job, Cassandra. I agree with everything you said. And teachers in our survey have indicated in their qualitative responses that this is a huge concern for them, that we aren't going to change our attitude toward testing, and they are going to face an impossible task.
And teaching is still happening, right? Like, we've figured out we can teach without the test. And so it is possible. And so I think we absolutely have to reimagine what their purpose is as we're moving forward. And we have an opportunity, a window of opportunity to do that. So we have about 10 minutes left. So I'll stop with this one last question that I know a lot of educators are thinking about before we truly wrap up. A lot of you, again, talked about in your opening statements about the need for building relationships. And this is related to the testing, right? Like, if I have the pressure of knowing my students have to know this content on this standardized test for their future and also for my own future as an educator, that is an added pressure, and also takes the time away from building the kind of relationships with students and with parents and with families that are going to especially be necessary in this moment. And so, because there is the possibility that schools, when they begin in the fall, will not start with face-to-face instruction. A lot of educators are trying to figure out now and are thinking about, how do you build those trusting relationships with students in a virtual setting. Because at least with this year, most of the educators at least knew their students. And so having to go into this format, while difficult, there was still a relationship there. But what about coming into a new school year with students who don't know their educators? What are some possible, obviously that will be a challenge, but what are some things that educators can be thinking about, can be doing in terms of how to build relationships with students in this virtual space?
So I'll get started. You know, it's the ultimate conundrum, right? The ultimate contradiction that what our communities and schools need to do to stay safe is to stay distant. And what young children need to stay safe is to be close. And so it's navigating that tension. It's recognizing that dilemma and sort of centering relationships in that. How do we, as you said, Monique, continue to foster relationships, both with children we know and children that may be joining our classrooms virtually or not, you know, in this new configuration where much of the time that we would have otherwise spent, you know, with them, getting to know them, doing some of those opening activities that helped us get to know children and families, and have to do that remotely. And it's been awkward, you know, for families and for especially little ones to stay tuned in to the iPad or to the computer while their teacher is either instructing or just conducting some of the morning meetings and those sorts of things. So I have just a couple of ideas really briefly, and it's grounded in the same concepts as development is grounded in, and in what we know about how to foster relationships between caregivers and very young children, whether it's in childcare, in families, in schools. So first of all, we want to have some predictability, right? We want to have some routines that kids can count on, that families can count on, so that they have some sense of control during this very chaotic, disruptive experience. So following through with plans, having set times to meet and greet even remotely, executing the same kinds of things in the same order so that kids know that their world is a little more organized than they may be feeling with the tumultuous nature of this pandemic. Secondly, reciprocity. It's really important to have that sort of what we call in early childhood serve and return. Look to see what the kid is saying or doing or interested in, and responding in kind and elaborating on that. You know, we need our young children to hear and feel that I see you, you're important, I notice you, you matter. So communicating those things, however educators can, is excruciatingly important for their health and well-being. And then finally, I would say fostering strong relationships with families. You know, that kids come in families. We actually have a saying in early childhood mental health that there's no such thing as a baby. You could say there's no such thing as a young child, meaning that child comes with their family. That child is grounded in a relationship with other adults, and it's critically important to foster those relationships as well.
I would just from my perspective of teaching online, I would encourage educators to bring a little bit of themselves, their personal touches to these meetings and interactions with your students. I don't know if it's a good thing or a bad thing, but my classes in the spring absolutely saw my 15-month-old many of class time. And I saw a number of my students' cats, dogs, brothers, siblings. My suggestion was allow for a space of just being familiar and a sense of, you know, this is not a fun situation to be in, but this is how we are. This is how we are living right now. But just having an honest a space.
I also think just at the leadership level, not assuming that teachers are going to know how to do this automatically, right? And so I think really taking some time in the professional development sessions that happen before school starts to really hone in on this. And for schools, as Jordana was saying, to know about their family community, how does their family community prefer to communicate and build relationships, and then using some of that knowledge to really give teachers some skills and some tools so that everyone's not just out there winging it in all the different ways is going to be important.
And I'm not a tech expert, but one of the things I do tell my students is just do whatever tech level you're comfortable at, because I tell them I'm not a techie. So I just say, you know, whatever technological area you're comfortable at, you can do that. And with the younger kids, I think that's something that important to stress to their families too, when it comes to younger kids, you know, because families are, my brother, for example, and we all know people who have done this, helping their elementary kids deal with the tech part of the teaching. And he was like, I don't know what to do. He was like, luckily the teacher called just in time. And then they were able to walk me through what I needed to do with the tech. So just honoring where families are with their tech level, I think is important. And of course, you can partner with your local university and the tech people at your local university and learning technology researchers to help out. But teachers already have a lot on their plate. So we want to make this as smooth as possible for them.
Okay, so we have about 3 minutes left. And so I want each of you in about 30 seconds to give us our marching orders. What do we need to do, whether that is on the administrative level, whether that is as educators, whether that is on the policy level, whatever level that you want to speak to at this moment of what do we need to do as we think about what our how to support our students and our educators for this upcoming school year. Jump in.
I'm going to jump in and just say to leaders, talk to your teachers. Talk to your teachers about what they need, give them a voice at the table in planning so that they feel like they have some agency and a sense of control in this time that's going to be really difficult for them.
And I'll say to educators, get your rest. Get your rest. We're gonna really need you. We already need you now, but continue to get your rest. And as things start to grow, or as things start to change, or if you're starting to feel certain, communicate with your leadership, communicate with your peers, but get your rest right now.
And to think about how we can, I like that, and to think about how we can role model emotional health and mental health well-being. So role modeling it, because it always starts with the self first.
If we have a theme going here, take care of yourselves, educators. We need you, as Cassandra said, and your mental health matters. It matters to you and your family. It matters to the children that you will be teaching. It matters to their families. So do whatever you can to take care of yourself and embrace your mental health as a critically important part of this whole picture.
That was great. Thank you all so very much for all of that. And we all as a society have to also push for that, right? Like we have to push our elected leaders to make sure that they are prioritizing the health and well-being of our educators and of our students and of our communities, because oftentimes we know that the people who are making the decisions aren't the ones who are actually going to be on the ground floor doing the work. And so we absolutely need to have a seat at that table and also have power and decision-making at that table. So I will end this session. Thank all of you for your expertise and for your knowledge. And we're going to end on the note of what Dr. Davis talked about, of as we look forward to the future, we need to look forward with the thought of what does justice look like in this moment? What does justice look like moving forward? And that is what we need, how we need to reimagine our schools and our school communities. So thank you all for this. Thank you all of you who have tuned in. We hope you got some practical suggestions and some things that you can take back. And I believe now that we're going to go on about a 15-minute break so we can get some non-screen time and some movement time. But thank you to our panelists. We really appreciate you, and we look forward to the rest of the day. Thank you.
Thank you so much.
Thank you all. I'm about to end the session now so we can begin our next panel. Thank you all very much. Have a good
Thanks,
day.
Joe, for your support. Appreciate it.
You're very welcome.
Thank you, Joe.
Bye.